My name is Samer Sayed. I am Lebanese from Beirut, Lebanon. I studied medicine at the American University of Beirut, and then I traveled to the United States in 2003 to do my internal medicine residency at Indiana University. In 2006, I traveled to New Orleans, Louisiana, where I spent 3 years doing my cardiology fellowship. And after I was done, I traveled to Cleveland, Ohio, where I did my cardiovascular imaging fellowship at the Cleveland Clinic. I specialize in cardiac imaging, be that echocardiography, computed tomography or CT, MRI, and nuclear imaging. I think cardiology is a little bit different than all the different areas of medicine in the sense that the heart is a moving organ. It is governed by the laws of physics and the laws of electricity. It can be imaged extremely well, and we understand a lot about cardiac pathology that we can apply a lot of our understanding to helping patients. I see patients for a variety of heart conditions, the most common of which is usually heart attacks and the consequences of a heart attack, usually related to weakening of the heart muscle and its inability to pump efficiently. Another very common condition that we see patients for is valvular heart disease. And valvular heart disease is essentially any disease that affects the heart valves so that they either become leaky or tight, affecting the blood flow. Another also very common condition that we see patients for is atrial fibrillation or disorders of the heart rhythm, and these can affect young and old people alike. So when I sit down with my patients, I like to listen to them. Listening to the patient is extremely important because basically that's how I can make my diagnosis and my assessment and plan. Every patient is different, every patient communicates differently, so it's very important that every physician listens to their patient. Then it's also very important that I perform a thorough examination on every patient and look at their objective data, and not just looking at their reports, but also looking at the actual images and sharing those images with the patient. Academic medicine is what I've done since I was in training, so I don't know any other medicine, but I've done that also because I believe it is the best setting where patients can get the best care. This is a setting where physicians can freely talk to each other, exchanging expertise and research experience, talk about patients in an open, non-pressured way, and ultimately come up with the best management for any particular patient problem. I knew I wanted to do medicine right from the beginning because I think probably this is one of the professions where you can really touch patients' lives on a day-to-day basis and make a difference.